This is your Chapter 30 video lecture out of your Modern Dental Assisting book. We're going to be looking at the principles of pharmacology. The most probable situation in which the dental assistant will be required to identify drug types are going to be when we're looking at the medication history, when we're assisting in procedures that would require the patient to take a pre-medication, when assisting in a specific dental procedure where we might want pain control, and then also assisting in emergencies. So drugs can be identified in three ways. They have their chemical name, their generic name, and then their brand name or the trade name. Classifications of drugs includes the patient medicines. So these are their over-the-counter drugs like their Tylenol, Advil, things that they would purchase from a drugstore. Then we have our prescription drugs. These are licensed medicines that are regulated by legislation and they require a prescription. So these are also referred to as ethical drugs, non-controlled or controlled. Controlled Substance Act, the Drug Enforcement Agency or DEA schedule of drugs includes Schedule 1, where there's no current accepted medical usefulness and they have a high potential for abuse. Schedule 2, they have a high potential for abuse, but we do use these in the medical field. Schedule 3 is less abuse potential and accepted medical uses. 4 is low abuse potential, and we use them in the medical field. 5, these are not required to be prescribed. And then 6 is an added classification in only a few states. A prescription is a written order provided by a physician or dentist for the preparation and administration of a medicine by the pharmacist. So only a professional who is legally authorized to prescribe medications can write a prescription, and a professional who is authorized to prescribe medications would then be issued a DEA identification number, and they would need that on the prescription in order for it to be filled. We do have some special terminology that is written, and all prescriptions are going to contain the superscription. This is the patient's name and address and the date. The symbol RX, the inscription, that's the name and quantity of the drug that is being prescribed. The subscription is going to be the directions for mixing the medication. We would then have the signature, so instructions for the patient on how to take the medication, when to take it, and how to take it. Then the dentist would sign it and add their DEA number. We do have some safeguards with prescriptions in the office, so we're going to, if they are on a pad, keep them locked in a drawer somewhere that only probably the office manager and the dentist have access to. The right prescriptions so they can't be altered. Keep duplicates in the patient's chart. The dentist should never pre-sign any prescriptions, and then we want to make sure that we're dating all of our prescriptions. There is some reference material for the medical users or medical field. This is a printed drug reference, such as the physician's desk reference or PDR, or the Motsby dental drug reference. Package inserts. So these are what you would get when you go and get the drug from the pharmacy. We would have a RCA information sheet that's going to describe the drug and then specific information, including how the drug is going to affect the body, what condition the drug is being prescribed, any adverse effects, any long-term effects, special precautions to follow when taking that drug, contraindications, and dosage and route for the drug. A dose is the amount that of the drug that the patient's going to take, and we do kind of factor in some information when we're determining, and that includes the age of the patient, how much the patient weighs, the time of day the drug is to be taken, and then the patient's tolerance to that drug. Administration of medications. So we have our forms of drugs, comes in pills, capsules, liquids, drops, ointments, sprays, gases, and lotions. The way a drug is administered determines how quickly it'll take effect. So a local action drug is applied directly to the site of use. Systematic action drug can affect the whole body by way of the circulatory system. The stages of action include absorption. This is the way the drug is absorbed from the site of entry. Distribution, the chemical compound of a drug attaches to proteins within the blood and is circulated throughout the body. Metabolism, so once the chemical compound is released, the drug becomes metabolized and is exerted through the liver or kidneys. And then excretion, the drug leaves the body by way of the kidney, liver, saliva, breast milk, and sweat. Drugs that are commonly prescribed in dentistry include analgesics, non-opioid and opioid, antibiotics, antifungal agents, antiviral agents, and anti-anxiety. Many patients who will be seen in the dental office will be taken prescription or over-the-counter drugs prescribed by their personal doctor because of medical disease. So we want to have a background knowledge of the drugs that our patients are taking and how they affect the patient's total health, as well as how they could interfere with dental care or drugs that we might prescribe to the patient. We'll see some of these drugs in health histories, so they can include cardiovascular, respiratory, gastrointestinal, neurologic, psychoactive, and endocrine or hormonal. Adverse drug reactions. So this is the body's negative reaction to a drug. We're going to review the printed insert with the patient to discuss any possible adverse effects that a drug could cause. Drugs can possibly interfere with normal function and may even create a potentially life-threatening circumstance. Common adverse effects of medications include hyperexcitability, insomnia, gastrointestinal, central nervous system effects, hypotension, and then fading, weight and appetite, skin changes, sexual dysfunction, opportunistic infections, and xerostomia. Complications include an allergic reaction. So we want to definitely know about this in the patient's health history, but this is where the drug triggers the immune response, and reactions can range from a rash or be life-threatening. Toxins induced with cell death, drug interaction. So when we're using multiple drugs at the same time, tolerance, so a loss of effectiveness to a drug over time, and then addiction, which is physical dependence on that drug.